Other news now, millions of people take fish oil supplements, but do they really work?
New information came out today, and cardiologists are starting to doubt their ability to ward off heart disease. CBS 2's Dr. Max Gomez now is here, and you say the science is stacking up against this stuff.
Yeah, this is a big change, and cardiologists are starting to realize this now. You know, people who eat a lot of fish high in omega-3 fatty acids tend to have fewer heart attacks and strokes. So the reasoning went, let's take the oil rich in those omega-3s, put it in a capsule. But when those supplements were studied scientifically, they didn't really pan out. Do you take fish oil?
No, I don't.
I just never thought about taking it.
Fish oil sales are booming, and millions of people take the supplement primarily to help ward off heart disease and its brain relative, stroke. But almost every study has failed to find any such benefit from fish oil. A study in the Journal of the American Medical Association analyzed 20 previous studies that included almost 70,000 people. The scientists found that overall, taking fish oil supplements had little or no effect on reducing a person's risk of dying or suffering a heart attack or stroke. But cardiologists caution that this type of study may have some potential weaknesses.
Multiple studies are grouped together, which include patients who are very sick, such as patients with heart failure. So some of the very sick patients, which may not have the benefit from this therapy, may cancel out the benefit that's present in a less sicker population.
Dr. Valentin Fuster, editor of the leading cardiology journal and chief of cardiology at Mount Sinai, no longer advises his patients to take fish oil. He agrees with the American Heart Association recommendation that eating fatty fish, like salmon and tuna, is a much better way to get your omega-3s and probably has micronutrients that are healthier for your heart and brain. Now, Dr. Fuster also told me that cardiologists today use statins, beta blockers, blood thinners, and other therapies that are so much more successful at treating heart disease that any benefit from fish oil is probably lost in the bigger effect of modern treatment.
So, other than this fishy aftertaste, is there any
burp like that?
Exactly, hours later.
Yeah.
Is there any downside to taking fish oil?
Well, aside from the expense, obviously, there's probably little downside to taking fish oil supplements unless you're also taking aspirin or other blood thinners at the same time. That combination could lead to bleeding, so you want to be careful because omega-3 fish oil supplements are blood thinners themselves. So be careful with that.
All right, Dr. Max,
Thank you, Dr.